Welcome to our latest video update on a pressing healthcare issue in South Africa. Today we are diving deep into the recent warning issued by the Health Minister to Operation Dudula regarding healthcare access for undocumented immigrants. This is a topic that's been causing quite a stir, and we're here to break it all down for you. Let's start with the basics. Operation Dudula is a controversial anti-immigrant group that's been making headlines lately. They've been pushing for stricter measures against undocumented immigrants, including limiting their access to public services like healthcare. But here is where things get interesting. The health minister has stepped in with a firm stance against this approach. Now, you might be wondering why this is such a big deal. Well, it's all about human rights and public health. The minister has made it clear that denying healthcare to anyone, regardless of their immigration status, is not only unconstitutional but also poses a serious risk to public health. Think about it: if people are afraid to seek medical help, diseases could spread unchecked, affecting everyone in the community. But there's more to this story. The minister's warning comes at a time when tensions around immigration are running high in South Africa. We've seen protests, heated debates, and even instances of violence. It's a complex issue that touches on economics, social dynamics, and national security. Let's break down the minister's main points. First and foremost, they emphasized that healthcare is a basic human right. This isn't just a nice idea, it's enshrined in South Africa's constitution. The minister stressed that medical professionals have a duty to provide care to all who need it, without discrimination. But here's where it gets really interesting. The minister didn't just stop at moral arguments. They also laid out the practical reasons why denying healthcare to undocumented immigrants is a bad idea. For one, it could lead to the spread of infectious diseases. If people are afraid to get tested or treated, they might unknowingly pass on illnesses to others. There's also the economic angle to consider. The minister pointed out that preventing health issues early on is much more cost-effective than dealing with full-blown epidemics later. It's a classic case of an ounce of prevention is worth a pound of cure. Now you might be thinking, but what about the strain on the healthcare system? It's a valid concern, and the minister addressed it head-on. They acknowledged the challenges faced by South Africa's public health sector, but argued that the solution isn't to exclude people. Instead, they called for better resource management and increased funding for healthcare. Let's talk about the legal side of things for a moment. The minister reminded everyone that turning away patients based on their immigration status is actually illegal. Healthcare workers who do this could face serious consequences. It is not just about following the law, it is about upholding the ethical standards of the medical profession. But this isn't just about laying down the law. The minister also appealed to our sense of humanity. They spoke about the importance of compassion and the need to see the person behind the label of immigrant. It's a powerful reminder that at the end of the day, we're all human beings deserving of care and dignity. So what does all this mean for Operation Dudula and their supporters? Essentially, the minister's warning serves as a clear message that their approach to immigration won't be tolerated when it comes to healthcare. It's a line in the sand, drawing a distinction between immigration policy and basic human rights. But let's be real, this warning isn't going to magically solve all the issues overnight. There is still a lot of work to be done in addressing the root causes of xenophobia and improving South Africa's healthcare system for everyone. As we wrap up, it's worth reflecting on the bigger picture. This debate about healthcare access is really part of a larger conversation about what kind of society we want to live in. Do we want a South Africa that turns its back on those in need, or one that upholds the values of Ubuntu, the belief in a universal bond of sharing that connects all humanity? The health minister's warning to Operation Dudula is more than just a policy statement. It is a call to action for all South Africans to think critically about these issues and to choose compassion over fear. As we move forward, it is crucial that we keep having these conversations and working towards solutions that benefit everyone in our diverse society. Remember, healthcare isn't just about treating illnesses, it's about building a healthier, more inclusive community for all. So let's keep this dialogue going and work together towards a South Africa where everyone has access to the care they need, regardless of where they come from.